started at Lutheran Medical Center, and one of the reasons was because it was an inner city hospital. Second reason was because it was a unionized hospital. And I always remember sitting at the table as a little girl listening to my dad, because he was a longshoreman in the LIA and he was a big union guy. So he would tell stories of how the union came in and helped with equipment or people who were getting hurt and the injustices that were happening. He says, wow, you know, this is a union shop in an inner city hospital. This is a great fit for me. I'm very passionate about nursing, and I found through the union and being a union member and being able to have a voice through the union, we're able to really help a lot of the communities, the patients in the hospitals for better outcomes. In COVID times, especially during the first wave, there was no PPE equipment, N95s, face shields. At the time, there was 3 trucks in front of the hospital, I'll never forget it, with refrigeration for dead bodies. The mental drain on you alone, that you're going through this, you're reusing your equipment, and now you're working 18 hours in basically an infected environment and not eating. The UFT union, before you know it, and Goldman, Mulgrew, truckloads of PPE equipment came to my hospital, and not just for the union members, but for all the healthcare workers that were there. We did not feel abandoned during those times. Most people don't even realize what nurses do. One moment in particular that stands out and could come to tears. I was taking care of this patient who was in a coma, who was 15 years old, who was septic, and I would talk to her every day. And I would talk to her, and never thinking she was hearing me. And on my day off, she was getting better. On my day off, she was transferred out to a regular med-surg unit. And by the time I came back, she was no longer there, and you move along in your career, and fast forward 1 year later. I'm in my unit, talking to the other nurses. The door, we buzzed 2 people in, and it was a mother and a daughter. And I was talking, and of course, with this Brooklyn accent, right? She said to me, you were my nurse. She said, I don't think I could have went through without hearing your voice. And to this day, I never knew. You know, you don't know, can they hear you, can they not hear you? That was when, I think I was in my 30s at the time. I'm in my late 50s now. And the proudest moment was that patient coming over to me and telling me, if it wasn't for me talking to her, she doesn't think she can make it through. And so moments like that, and that was one of many, but moments like that make me so proud